Hi, my name is Ethan Lambert. I'm a junior in animal science, and I'll be talking today about the misuse of phenylbutazone, otherwise known as Bute, in the equine industry. So the first question is, what is Bute? And it's short or commonly known as phenylbutazone, which is often referred to as Bute, is a non-steroidal anti-inflammatory drug for the short-term treatment of pain and fever in animals. So this picture here that just showed up is just common like capsule or oral, and then the bottle is injectable. It just depends on your personal preference or what your veterinarian recommends. And those are just two of the forms of Bute. Another common question is why use Bute? Because it's available in granules, which is basically a powder, like you would sprinkle it on the feed, for example, or tablet form, or a paste. Either or, they all can be used orally, administered by the mouth, or it can be used in liquid form for injection. I personally would use the orally because it's it's cheaper and it's just easier to do, less invasive on the horse, and so for matters that way. And as it says below, it can be administered in a multitude of ways. People also use Bute because it's easily accessible. You can get it easily through your veterinarian or ways like that, or it is also inexpensive and effective when used properly. And when it, obviously when it's effective and it's not expensive, you're going to want to buy it and you're going to want to use it quite often, which also leads into why it is abused and misused in the industry. So the next slide talks about improper use of Bute. These are examples of what you should not do and what you should never do. You should also, if you see these or come across them, you should report them to a veterinarian or someone who can handle the matter and take care of it to eliminate improper use. So continuing on the slide, using something you shouldn't do is using high dosages for extensive periods of time. As stated, and longer than 14 days is extremely detrimental to the horse. After 14 days, it really takes a toll on the digestive tract as well as possibly the entire body of the horse. Phenylbutazone is not to be given to a horse longer than 14 days, except for instances dealing with laminitis or chronic arthritis problems. When you are dealing with one of these situations with laminitis or chronic arthritis, it is key that the minimum dosage of 2 grams should not be exceeded, and it should be in oral form. They recommend that it be in oral form because it's less invasive on the horse, and when you have to continually give a horse a shot after 14 days of continual needles, that builds up scar tissue and can be detrimental to the horse. The horse should also be monitored extremely carefully, since some side effects can appear when the horse is on a small dose, as well as look for any abnormal or odd behavior while this horse is on an extremely long-term Bute regimen. Another improper use of Bute commonly occurs via incorrectly following labels. Clearly this can be detrimental to your horse's health as well as possibly fatal if not caught in time. In the bottom right corner here, I have included a bottle that a phenylbutazone injectable. It's clearly stated in the red boxes there the proper amount that should be administered, and it also says how much grams per weight to use. And finally, another way to improperly use it is to disregard the recommended dosages your veterinarian has provided you. You should always trust your veterinarian when administering Bute. If you don't feel comfortable doing it, allow your veterinarian to come out and do it for you. But please follow the advice of your veterinarian, as they are very experienced and went to school for this sort of thing, and you should always trust them. Next is the proper use of Bute in horses. This is what you should do, and this is the protocols that you should follow, as well as if you have any questions, consult your veterinarian about it. So first on the slide is the recommended dose. The recommended dosage for a 1,000-pound horse is 2 to 4 grams per day for 4 to 6 days. Now these numbers will vary on a per case basis, and when your veterinarian recommends something else, please ask questions and get a clear understanding of why those numbers have changed. The recommended by the manufacturing company is based on extensive and very extensive research that they've done to obtain approval to sell the drug and market it. And also along those lines, the extensive research allows it to be marketed and used in a safe and effective manner at all times. And once again, I can't reiterate it enough. Just work with your veterinarian to provide the most precise and accurate dosage. Doing that will, prevent side effects and will ultimately help heal your horse quickly and efficiently and effectively. And just always just think of the horse's health first, and no matter what the cost. In conclusion to the presentation, the recommended dosages are scientifically proven and should be followed, unless, of course, your veterinarian says otherwise. Next is using high doses of Bute for extended periods of time will take a negative toll on the horse's body and is proven to be detrimental to the overall health. And lastly, when in doubt, consult a veterinarian for professional help. And I'd just like to say thank you for listening. And the next slide I've also included my works cited. And thank you very much.